A lot of times we'll use Teddy Bear Clinic. Kids gain mastery over medical experiences. It's a great way for them to have control. It's something that a lot of programs throughout the country have done as a way to provide mastery and promote coping and familiarity with medical equipment. It's a great way to kind of desensitize some of the medical equipment that may seem really scary. A lot of the stuff in the surgery station, is kind of frightening, but this desensitizes some of that and makes it a little bit less scary.
The teddy bears start at registration. That's where we collect media consents behind the scenes from the parents, and then they are triaged in a pretend emergency room environment. Next, they will go and get their IVs, have labs drawn. They may even have radiology procedures such as an MRI, and then pre-op may have surgery, do their post-op, and then sign their paperwork, their after-visit summary, so that they can go home.
Sometimes kids have misconceptions about why they're in the hospital or why their bear's there. It's interesting to watch most kids, the problem or complaint that their animal has or their bear has is typically what is going on with them. You'll see a child with a broken leg come in, clearly with the crutches and a cast, and when we ask what's wrong with your bear, oh, my bear has a broken leg. I love observing kids in medical play because a lot of times they know so much more than we think they know. Sometimes opportunities that we have for the patient are not available to siblings, and it's really common for them to get forgotten about or left out. And families a lot of times aren't thinking about the sibling, and it's not ill-intended. Their focus as a parent is on that child who is sick or hurt. Sometimes even without knowing it, siblings can kind of get shoved to the side. We're very inclusive in that. We want siblings to attend and participate in that with their brother or sister who may be ill or sick. And it helps them understand too what goes on at the hospital. So it's fun for the staff. They get to be creative. So, and most of the staff today said, we want to come back. When's the next one? Let us know. We'll be here.